It's a wonderful recognition to be acknowledged for this, particularly because it's coming from nominations from peers and colleagues who work in the area that we specialize in. So to me personally, it's a huge honor to be recognized. The fact that a peer or peers nominated me is very important because they know what we do, they work in the same area, and that's a huge recognition, and it's a huge honor to be recognized by your colleagues for what you do. It's the highest level of recognition when other physicians really nominate you for something that you do every day. So I decided to become a physician. I was influenced by my father, who was a physician, also my uncle, who was a gynecologist, so it was in the family. And I always, from a young age, liked science. I liked to teach and I liked to take care of people, so going into medicine was very natural for me. I would do it again if I had to do it. And choosing GYN oncology really became more clear to me. In the area that I grew up with, there was a huge need for gynecologic cancer care, and there were no specialists in GYN oncology. So I always felt a need to become a GYN oncologist, and that's kind of how it started. So it's a very good question about patient experience coming to MSK. We're fortunate at Memorial Sloan Kettering that we have a setup with a lot of support for patients when they are diagnosed with cancer. Being diagnosed with cancer really is a very challenging point in time in your life, because you feel like life is ending, and it's a huge complicated medical condition. Fortunately, we have a lot of support to help manage patients who come in, and this is a big team effort. No single person can do this alone, so we rely a lot on our nurses, our fellows, what we call the disease management team, all our colleagues, to help with an accurate diagnosis and to plan treatment, and of course make sure that the patient is heard, and what she wishes really is the utmost importance in the decision making. So it's a very good question too about the complexity of the healthcare system, particularly in cancer. Cancer care has become a lot more complex. Lots of options, lots of choices. I strongly encourage patients to think hard about where they're treated first. Where you're treated first makes a huge difference. Always encourage people to get a second opinion, sometimes a third opinion. Make sure your diagnosis is accurate. Make sure you have all the information that is needed from pathology, from radiology, before you embark on a treatment. Again, where you're treated first makes a huge difference. Feel free to ask questions. There's a lot of information out there. A lot of people are willing to help and give you advice. Do your homework and make sure you have the information before you start your treatment. The doctor-patient relationship is a very complicated matter, and it's certainly changed over time. Growing up, when my dad was a physician, I believe the way he had relationship with his patients is different from how it is now, and it'll be different in the future, without any doubt. Cancer care and healthcare in general has become a lot more complex and complicated, with much larger systems, much bigger groups taking care of patients. So it will change, but it is important for us to really try to maintain this important relationship between patients and physicians and their healthcare providers. But definitely it will change, and it will be different from the way it was 60 or 70 years ago.